Can you explain real quick? Because, people who maybe aren't, I'll have folks that are going to be listening to this that are in healthcare. Maybe they're in pharma. Maybe they are in sales and they're in real estate. They're just picking it up because somebody said, "Hey, listen, this is a good sales podcast." Give me just your take on what makes Diagnostic Lab so unique.
Well, there's a number of reasons. First of all, I don't know the exact stat, but it's something like 85 or 90% of all medical decisions are based upon what happens out of a diagnostic result. So it's the critical first step in the healthcare process. You're a patient, you have a pain. You're a patient, you don't feel right. You're a patient, whatever it may be, you have to get a diagnostic to help the clinician understand what's actually happening with you. So we are the tip of the spear. We are the people that are going in first and really providing critical information for patient care. And so that's not only exciting, it's important. And unfortunately, because so much focus is placed on what happens after the fact, the labs aren't always considered the redheaded stepchild, if you will, of the healthcare industry in terms of where funding goes, in terms of where innovation goes, from government investment in innovation and so on. And so that means the diagnostic labs and all the diagnostic companies that are out there have to be innovators themselves. They have to be able to drive new ideas and new tests and new means of conveying the information in those test results back to patients and clinicians in order to distinguish themselves in a very otherwise commoditized market. I mean, you've got the two big players, LabCorp and Quest, but everybody else has to really drive through their sales force, their marketing, through their lab operations, through every step of the whole process, a means of really claiming territory as to what makes them different and important.